So if there is any if this SA node impulse is generated at a very slower rate or at a very slower pace, then it may lead to the slow heartbeat. Or if there is, as the regular beat range from 60 to 100, but if there is a blockage or if there is a fail in the discharge of the rate, and if this rate is not regular or the signal or impulse is not generated from the SA node at a regular intervals, then it may also lead to the slower heart rate. And the most important, if there is any blockage in this impulse which is generated from these nodes, like most important the SA node, if there is any blockage and there is no signal impulse generated from here, or if the atrium there is a pause for the filling of the atrium and for the contraction of this atrium, then it may also lead to the slower heart rate. Then as the bradycardia, it may also be normal, like in some cases, like if the person is is in case of rest, or if the person is sleeping, so the heart rate may also be slow for that specific amount of time. But in normal conditions or during the normal activities of the life, if the heart rate is low, then it may be due to certain pathologies or maybe due to certain conditions. So what are these conditions and pathologies that may lead to the slower heart rate? These include maybe certain medications that are used for lowering the blood pressures. These medications may also lead to the decrease in heart rate, or there may be certain congenital defects, like by birth there are some defects maybe due to which the heart rate may be slow. There are certain thyroid diseases, like the abnormality in the hormones, imbalance of the hormone levels, such as hypothyroidism, may also lead to the bradycardia, may also be responsible for the slow heartbeat. And obstructive sleep apnea, that if there is many times if there is a disruption in the cardiac rhythm, then it may also lead to the bradycardia. There may also be the slower heartbeat. And there are certain inflammatory diseases such as rheumatic fever and lupus. And also in case of high blood pressure, the heart rate may lead to the bradycardia. So these are the certain pathological conditions that may lead to the slower heart rate less than 60 beats per minute.